Hi, it's Peter with Physical Therapy TV. We're going to be dealing with a specific exercise that you can use for shoulder pain. This is the sixth video in a series of videos that we've created for you dealing with shoulder pain. You can check out our channel, YouTube channel, to see the playlist with the shoulder pain exercises. Let's just quickly talk about your symptoms before we get into the exercise itself. It's important to pay attention to your symptoms because it can tell you a lot about the type of injury that you're dealing with. If your shoulder pain's been going on a while and it seems like it's a constant throbbing, aching pain in the joint, could be some chronic inflammation that's not resolving in your shoulder joint itself. It's important to get a handle on this and get it taken care of. You can use anti-inflammatory medicines. The doctor can use a cortisone injection. Ice is very helpful. But if this is unresolved, it can turn into some scar tissue in your shoulder and weaken the muscles of the shoulder, and can cause some permanent damage. Also, if your pain is sharp, especially when you reach up across your body or up behind your back or overhead, could be an impingement injury, and that could be related due to some weakness and tightness of muscles surrounding your shoulder joint. Could also be a rotator cuff tear. If your arm is significantly weaker than the other side and you have sharp pain in different angles, could be a tear. So it's important to pay attention to your symptoms. Check with your doctor or therapist before you attempt this exercise, but this is a great exercise to improve mobility of your shoulder, the way, freeing it up to move better, but it can also strengthen your shoulder joint. It's called an arm slide exercise, and it's basically going to do just what it said. You're going to stand and back up against the wall, try and bring your arms up to about 90 degrees. 90 degrees at the shoulder and elbow joint. Try and keep the head, the shoulders, the butt, and the legs up against the wall. If it's not possible, just try and get your arms back as far as you can without hurting yourself. And then you're going to just slide your arms up and down against the wall, keeping the arms in contact with the wall if you can. You'll feel a stretch in the chest, which it does. It gives you a good stretch in the front area of the shoulder and the chest muscles, which are typically very tight and one of the primary reasons for impingements in your shoulder joint. And it also strengthens those shoulder blade muscles in the back as well as your external rotator muscles. So great exercise to work on both mobility and strength of your shoulder joint. You can do about 10 to 20 repetitions, take a rest break and repeat. Do that 2 to 3 times a day. I'm sure it will help.